Hi, my name is Paula Sowers, and I'm with the Latin American Chamber of Commerce. I am the current president. And one of the things of being president this year, I have met so many amazing people. And one of them is Lauren here, who is joining us today to talk a little bit about a project she's working on. Lauren, why don't you tell us a little bit about yourself first, and then we'll dive into your project.
Hi, everyone. Thank you so much for tuning in. And thank you, Paula, for taking the time to really speak with me. I'm Lauren. I'm a senior studying neuroscience at Notre Dame, originally from outside of Chicago and just a couple-hour trek to get here. Definitely used to the chilly weather. And yeah, I'm really excited. I'm doing a project, like Paula said, we're looking at prenatal supplement, prenatal vitamin usage in South Bend and kind of looking at how much are people using the supplements, accessibility, barriers to accessing these supplements, and really just trying to gain a comprehensive picture here.
Okay, so you told us a little bit about your project. So what is the background that went into coming up with this project?
Yeah, so I knew that I wanted to do some sort of project. I want to go to med school and I'm really interested in women's health. And so I came into this knowing that I wanted to do a project focused on especially some topic in women's health. I'm really interested in prenatal supplements and how that plays in. And when I started to try and do some preliminary research for the project, I realized that there just wasn't a ton of research I could pull on yet. And so that's where I'm working with Dr. Michael Morris at Notre Dame. And we decided that really a great focus for the project would just be laying those foundations and, trying to do that research and find a baseline of, a picture of what's going on.
That's amazing. I just love it, when, especially our Notre Dame partners and how they're reaching out to the community. That's just amazing. Thank you, Lauren, for that. I also want to ask you, what is the end goal of this phase of the project?
Yeah, so kind of talking about right now, we're really trying to set that preliminary research, because when we think about the big picture, I think it's obviously you do the research so that you can do something good with the data. And so we're actually partnering with Kelli Brien, she's the founder of SpeakLife Doula services. And so I think eventually in the far future, what we really want to do is use this data for good and, figure out, are there barriers? Are people having hesitancy? What's going into this process? And I think in this phase, what we're trying to look at is just, where are we now? Because before we can make any action, any recommendations, we need to know what we're looking at. And that's really kind of this phase. And then I think future goals really get into, so we have this data, we know. What is the usage? What's the status? What barriers are people facing to access prenatal supplements? Is there communication issues? Is it, transportation, things like this, just really trying to gain an honest picture. And then I think it's looking for ways to implement this. Dr. Morris and Ms. Brien, as well as Notre Dame Center for Social Concerns, all are involved in this project, have access to the data. And so that's really, we're laying the groundwork. So I'm excited to see what we do after we collect the data.
Well, that leads right into my next question. What are the future goals for this project?
Yeah, and I definitely think there's the brief, cheesy slogan, do good. But I think that is applicable in that I'm a really big fan of the idea that, knowledge is empowerment. And I think that when we talk about, wanting to make an impact in the community and really wanting to look out for the health of those around us, especially people who traditionally aren't as served by the healthcare systems or who sometimes are overlooked, not prioritized. I think if we're going to help people and if we're really going to get to the root of everyone's health matters and we really want to, we want to push that, I think we just need the knowledge first and kind of give that empowerment. And so short-term research project, I want to get, the data, we want to figure it out. And then working with Kelli, whether that and other community partners, Dr. Morris, just the data will be published. It will be in a document available. And I think just using that to make change. So whether that's, we see that transportation is an issue, working to find ways. We see that terrible side effects are an issue, working to, suggest supplements that don't have as bad a side effects or, work to make those more available, things like that. So I think it's lots of big, far-reaching goals that are just going to start with getting this information first.
That's amazing. So with that in mind, what are ways in which people can get involved?
Yeah. And so the big thing is to make these changes in the future, we do need the data. And I think that's a lot of, evidence-driven changes. That's what we want to talk about when we're doing this is, going into the community and especially areas where, like I said, people traditionally maybe don't always have the best access to healthcare or haven't always historically been treated how they should in healthcare settings. And, getting the data. And that's going to be what helps us really have these evidence-based changes. And so I think for sure, just spreading the word and helping get information. We want to picture the community. So that means the community really telling us what they think and just helping, I think, spread awareness and data collection would be phenomenal at this point. And also feedback on the survey, on the process. On the survey, I have my email and my number linked. And I think that's something Dr. Morris, Kelli, and I are really focused on is if we're doing this survey with the community, we want feedback from the community about, do you think we're doing something good? How do you think it's going? What are your thoughts on this? Because it really is, like I said, the cheesy quote of do good, but I think it is, we want to do good and we want to, really partner with everyone possible and just spread the word. And hopefully we'll get enough responses that we can really have an effective evaluation of the data and find some real trends, some information and contribute to the general knowledge base.
So, and just so that people are aware, you're looking for people to fill these surveys out, but you're looking for specific people.
Yes, thank you.
Who are we looking for?
Yes. So first of all, we're looking for people who have been pregnant in the past 5 years, just because the first survey is about supplement usage, supplement barriers, and as we know, memory past those 5 years. For me, I couldn't tell you exactly what I was doing 5 years ago and just, trying to keep accurate with our data also about, present conditions. And then, like I said, we really do have a focus on underserved community, like underserved groups who traditionally maybe aren't as acknowledged by the healthcare system. And
all right, Lauren, thank you so much for this amazing and wealth of information and the things that you're doing to help Kelli and all the other participants to get that data going. So with that said, the link below, if you click on the link below, that's where you can get access to the survey. Anything else you want to add to that, Lauren?
I just want to thank everyone in advance and thank you for taking this time to speak with me. I'm so excited to see where this could go. I feel so lucky during these past 4 years to learn so much about South Bend. The community here is extraordinary, just learning about the advocacy in the community. And just thank you for taking the time to speak with me. Yeah.
Oh, no problem. It's been great. And I've always loved, meeting new people and especially young people like yourself who is very interested in wanting to make a change in our community. I really appreciate that. Thank you so much.
Yeah, thank you.